विसावपरांत तुमकां येवकार. भारतात धोपरा बदलपाचे शस्त्रक्रियेचेर दुयेंती कित्याक खुश आसनात ह्या विशयाचेर डॉक्टरांचो रिसर्च चालू आसलो. फाटल्या 7 वर्सां सावन ताचेर रिसर्च जालो. ताका लागून जिनियस ही नवीन सिस्टम फुडें हाडल्या अशें डॉक्टर अमया वेलिंगकर हांणी सांगलां. आर्डिक्सो खातीर पणजेच्यान संजय मुनाली.
In my 14 years of my career in arthroplasty, now in joint replacement, what I realized is, and I showed a lot of videos of the US based crowd or the UK crowd who are doing extremely well after a knee replacement. But what was the biggest lacunae is that the Indian patients after a knee replacement would not do so well as the Caucasian population. For the last 7 years, we are doing a research on this new knee and what is the basic problem. First, I learned how to do a knee and a hip replacement. Then I tried to perfect the art, and later I realized that knee replacement is not a perfect surgery as yet. The reason is Indian patients behave differently for a knee replacement as compared to the rest of the population. So the need to innovate something for the Indians so that they are more happy after a knee replacement arised. And for the last 7 years we have been researching on these measurements of the bones, which are generally derived from after surgeries or from cadaver studies, and we found that there is a significant change of the bone structure between the Asian population and the Caucasian population. And this difference has been incorporated into this new system called as the Genius.
This is, we're talking about mobility, and the link with me with this mobility are two things. You know that when you operate between a disc between two vertebrae, we used to fixate them. And then with the time, instead of going in the neck of a human being and having to fuse their two vertebrae after removing a disc for them to be able to get the pain in their arm and the neck away, we would fuse them. And I am old enough to have experienced the fusion that we get the bone from the hip and put it in the neck. This is the Cloward operation we used to do. And then you would fixate two. And when you fixate two vertebrae, what happens is that you have overload with the other articulation above and below, and you have what we call an adjacent segment disease. And then we said, why not give mobility? A knee is a mobility you want to get.